Hi, good morning. It's Dr. Rajeev Fernando with Shiraj, and I'm here in Rwanda. 1 mile south of here is the border to the Democratic Republic of Congo. Now, the tension is palpable here in Rwanda. Is the Ebola virus going to cross over the border and disseminate over to Rwanda and cause an outbreak over here? You can see the government's done a great job putting up mass media over here, which shows the signs and symptoms of Ebola virus and what to do when you get these signs and symptoms. Head straight to the hospital. So where did Ebola come from? We're here and we're actually looking for the vectors for Ebola, and I think we actually hit the spot over here. You can see that over there. So some of the vector-borne diseases which come from these animals and seed human beings accidentally are HIV, which comes from chimpanzees. We also have the hantaviruses, which come from rats, monkeypox, which obviously comes from squirrels. And then we have these bat-borne diseases. Bats, what's the deal with bats? It's interesting to know there are 1,116 species of bats, and it's 1 out of 4, which means 1,116 species of bats account for 25% of all the mammals they are right now. Now, let's backtrack a little bit. This current outbreak started in August of 2018, and it's the 10th outbreak in the Democratic Republic of Congo since it was first identified in 1976. This outbreak is easily the worst outbreak that we've ever seen in the country. Where did it go? So it started first up north in North Kivu, slowly tracked its way south, and now it's fast approaching a town called Goma, which is of big concern. There are other borders which are of concern as well, South Sudan and Uganda. The biggest difference I see between the 2014 outbreak in West Africa and right now is vaccines. The Democratic Republic of Congo, the government has done a wonderful job. They've given about 80,000 vaccines so far. Also, people at the borders, about 2,700 vaccines have been given to South Sudan, Uganda, and over here. The problem with the vaccines, for starters, are the heat stability. Now, it's a race against time. Once you get these vaccines out, you gotta get it to the people as soon as possible. The temperature the vaccine needs to be stored at ranges between -60 and -80. Some of the villages are about 13 hours away. We do have a great organization from the States, MAF, which actually helps carry these vaccines all the way to these villages in smaller airplanes. The other downside I have about vaccines over here is the Democratic Republic of Congo has been long known for their gender-based violence. Some of the organizations, if the wrong people get the vaccine, they're using it for exchange of sexual favors between women. That's a reality on the ground, so that's something that has to change. The next thing I want to talk about are antivirals. We didn't have it the last time around. We have them right now. These antivirals, MSF actually started giving it about 2 weeks ago. The results are good so far. We need to follow it prospectively and see how it does. Some of the other things I do want to talk about, the downsides of this outbreak in 2018 is the big civil unrest. There are a lot of militias over here fighting, different groups fighting against each other. And that is a big problem in trying to treat people over here. You know, you have all these militias coming in between, and this disrupts treatment and mass movement. So that's something that has to change. The second major problem I see is healthcare systems actually giving Ebola virus to the people. Within the last month, we've seen 1 out of every 5 patients with Ebola virus have visited a healthcare center in the last 30 days. That's a big problem. Let's go a little bit further north, where 86% of people who get Ebola virus disease have actually visited a hospital. This is a big problem. We really need to get this changed. I think some of the things we can do, what I suggest is maybe checking temperatures of people when they come in, healthcare workers, doctors, nurses, staff, when they get into the hospital facility and screen better. Hand hygiene, I can't specify anymore. It's so critical. How do you know whether hand hygiene is good? Start washing your hands. Sing happy birthday twice and you're good to go. Nothing's changed between the last time and this time with regards to foreigners. Now, the last time around, when I was in Sierra Leone and dealing with this outbreak over there, there was a general mistrust to foreigners. A lot of the people actually thought that Ebola was created by the foreigners when they came here. And people, when they were sick, they go to the hospital, they sort of knew that no one is coming back home. And there was some talks whether the foreign organizations or NGOs were actually harvesting the organs. So that is a big problem over here. That's not changed between 2014 and now. Now, what about the other things about travel? Now, the last outbreak we had, between Sierra Leone, there were direct flights to London, which means someone sick in Sierra Leone, they could just get on a flight and fly directly to London. At that time, in 2014, there was the Commonwealth Games, and there was concerns whether that could spread over there. Now, in this situation, there are no direct flights from the United States or Europe, Australia, or Asia. There are no direct flights that come over here, which means someone has to take multiple different planes to get to that region. It's another important thing to know. Now, in my professional opinion, I don't think we're going to have a problem like the last 2014 outbreak. There's not going to be a pandemic, but remember, this is at this time. We need to be continuously maintaining clinical vigilance to see how this is. We will see you on the other side of the border in the Democratic Republic of Congo. Thanks for joining me. It's Dr. Rajeev Fernando.